know that the emergency department is the front door to the hospital for many people in this community. And we wanted to make it as inviting and as comfortable a space as possible, not only for our patients and their families, but for the people that work here.
Talk of upgrading and updating the unofficial front door of Arnott-Ogden Medical Center began years ago.
We started looking and making plans as long ago as 5 years. The ground broke the first part of 2020.
But the project couldn't have come to fruition without the input and guidance from those who spend the most time in the ER.
The nursing staff and the frontline folks who have to be involved in that department every day, and security and environmental services, and all of the people that provide services in the emergency department and who depend on the emergency department to work effectively and efficiently.
And Arnott staff members say this approach left no stone unturned.
They're mainly all single patient rooms now with glass doors for patient privacy, and each room is kind of really set up to allow the patient to be comfortable and the patient's family, but also allow the physician and nurses to work there as well.
Almost exactly 2 years later, the final touches are being put on, and the hope is
that the patients in the community here will find that this is a comfortable, safe, secure, and efficient place to receive care.
In this multi-part series, find out how the new space will provide a better patient experience, see how technological improvements will allow our staff to provide better care, and learn what new sections of the ER can offer to incoming patients. Before the renovation, emergency room staff wasn't equipped to help all patients as soon as they came in.
One thing we did not have was a resuscitation room that was dedicated for patients that are the highest acuity that need to have the greatest intervention, be it a trauma patient or a cardiac arrest.
Arnott's administration wanted providers to have the ability to care for a wide variety of medical needs, but overhauling the department meant making adjustments to continue serving the community.
We literally could only change very small items, and then in the middle we would ask the construction folks to help us out because we're having a surge. We need this done so that we can accommodate our additional patients.
And ongoing construction created some challenges.
Realize that there's not a hallway shut down or a room shut down, and we can fully staff the department and we can fully fill the department and care for our patients.
A trip to AOMC's ER no longer means dealing with the chaos of a construction zone.
There was noise, patients definitely aren't going to enjoy that kind of an experience, and so we apologize for, pardon our dust, because we're making things better for the future. And we're finally there now, and it's going to be a lot better not having to deal with some of those nuances.
But working around and adapting to an ever-changing construction site wasn't in vain.
Not only is it aesthetically much more pleasing, but it is a more comfortable, more accessible, safer, more efficient design.
The current layout was designed to avoid the need for another large-scale renovation.
We realized that there were opportunities to redesign it in a way that would enable us to expand it more easily in the future at a reduced cost.
In the next video, we'll explain how the layout of Arnott's new ER is changing the patient experience, what to expect when you walk through the door, and how the medical staff can help you.
The emergency department literally is the front door to the hospital. The vast majority of patients admitted to the hospital come through the emergency department.
And now that renovations are over, operations are on track to run smoother than ever.
The patient would be registered, quick-regged, and then brought into those rooms. The triage nurse can see them. They can be seen by a provider. They can have a tech draw their blood, but the triage nurse is not a static position any longer.
Some people may come in with something that can be treated in a shorter amount of time.
Finger fractures and arm fractures and colds and lower sickness stuff that we can see quickly.
The facility is equipped to handle a variety of patient needs.
We set up additional treatment stations that allow us to take care of patients that maybe don't need a bed, but they need a chair.
The chairs provide a place
for patients that maybe don't quite meet criteria for being admitted, but can be placed there then for up to 23 hours so that we can maximize their therapy and care, and then maybe then they'll be good enough for being discharged.
Whether they're in a chair, in a private room, or in the observation unit, when someone hits a call bell,
it rings here, it rings at the station. We can talk to them, but one thing we integrated in, it can't be canceled from the station. So someone must come to the room.
And that feature avoids the issue of
somebody just getting busy and canceling it. We wanted everybody to come to the room.
With enough space to fit over 50 patients in the ER.
We are looking at improving our workflows and our processes to improve throughput and decrease wait times. And you know, we're kind of working with the new layout and trying to understand what that'll look like. But ultimately, that's our goal, is to get folks in and get them seen quickly and get them discharged or transferred as soon as possible.
What this tells our community is that ARNET is invested in them as individual patients. We're invested in their families. It also tells our staff that we are invested in their professional work environment.
In the fourth and final video, hear from some of the staff in the emergency department as we take a deeper look into the new equipment and how it can be used to care for individualized patient needs. Renovations to the emergency room at Arnett Ogden Medical Center were done for a number of reasons. But
our big focus here, because of the way this department was spread out, was that the supplies and the equipment be at the point of care. We want our providers and our practitioners to be able to stay where they're at, to take care of their patient, not be looking or running for supplies.
Supplies weren't just moved closer to the medical staff and patients.
The equipment and the technology is way more advanced than it was when I first started, obviously, and I think that will allow us to care for our patients in a more effective and timely manner.
People who need immediate treatment now have a place in the ER's trauma room.
Having all of your critical equipment for that very high acuity patient in the same place makes it easier then for if you need to grab equipment in order to help take care of that patient. Also, it's a climate-controlled environment and has a lot of other bells and whistles that really make the job easier.
Doctors no longer need to run to and from different areas of the hospital to try and treat multiple high-acuity patients.
And then after the patient is stabilized, you can transfer them into another room. That way you're ready for the next critical case.
If there aren't any rooms available, medical staff can put patients in a bed in the hallway of the ER and still provide proper care.
When the volume exceeds, the space, so to speak, we do put people in those beds, and the beds here are actually equipped with oxygen and suction and call lights, which really help us maintain patient safety even in those areas that we really don't like to use.
Through hard work, communication, and drive, Arnett's staff was able to create what they feel is the ideal facility to serve the community.
Really kind of looked all over to see how best to make our ED most efficient. So we did tours of different emergency departments that were recently renovated to see what worked well there and how really just to best optimize the experience.
Nobody would have envisioned having to do this during a global pandemic, and so I really take my hat off and applaud everybody that's been involved in this project.
We're very excited to have those new eyes and fresh eyes in a leadership role, working with our already exceptional medical staff in the emergency department, exceptional nursing and technical staff, our EVS staff that are deployed there.
We appreciate the community's support and look forward to being able to care for them in the coming days in the future.